The presence and function of pathogen microorganisms such as bacteria and viruses, especially under the protective environment of a biofilm, has been of great interest to many people. In the case of people in the medical healthcare field, because these microorganisms, the bacteria, the viruses, cause diseases and make people sick and sometimes endanger the patient's lives. In the case of biomaterials engineers who are interested in implant materials and devices, the presence and growth of pathogen microorganisms and biofilms or implant materials and devices results in major complications and leads many times to the failure of our favorite materials and our favorite implant device. The condition which is pertinent in this respect is referred to as infection, and this is the topic of lecture 21. Starting with a definition, infection is the invasion and multiplication of pathogen microorganisms such as bacteria, viruses, etc. inside the body, in tissues, organs, and around implants. An important comment pertinent to the work of biomedical engineers was a comment that was made by one of the pioneers in the field, Professor Black. Remember, we have been interested in reviewing how tissues heal around implants and how we can promote, by understanding what nature and the physiological environment do, how we can apply that information to promote new functional tissue formation. Dr. Black brought to our attention the fact that if there is infection plaguing that particular location, the tissues, the organs where our favorite material and device are implanted, we have a situation which is a competitive process, and it is a competition between the invading bacteria to attach and grow and take over the implant, and the ability of the host tissues first to defend themselves via the natural defense system of our bodies, the immune system, and the activation and function of the white blood cells, which of course are programmed by nature to recognize these bacteria and viruses and other such microorganisms, and they are programmed to enclose them in their cytoplasm and through the process of phagocytosis to kill them. Therefore, what we have, if we translate this information now towards the biomaterials exclusively, is a phrase which some other biomaterials colleagues, pioneers in the field, put together, and they call this the race for the surface. The race, who is going to get there? Is it going to be the bacteria, the pathogens, or is it going to be the cells from the normal physiological surrounding tissue? They're going to be competing for a place on the same surface that you and I, as biomaterials, biomedical engineers, have designed, formulated, and produced. And one more aspect which we need to keep always in mind is that the processes by which mammalian cells use in order to adhere and then proliferate and then grow and form new tissue is very comparable to what the bacteria and such microorganisms do. Namely, they have membrane receptors which recognize various epitopes or domains in extracellular matrix components, and therefore once, especially when they have produced and deposited their own extracellular matrix, then they can adhere and grow and keep growing, especially protected by the biofilm. This slide illustrates a bacterial colony growth on the surface of a substrate. It is impressive to see the large number of such bacteria on the surface. Please keep in mind that the color is a pseudo color which was used in order to make this particular colony of bacteria visible. Biomedical engineers have been interested in what happens when bacteria interact with implant materials and devices, and we have a list of conclusions and observations which have been made and have been reported in the literature. When some time goes by, once the bacteria have colonized a particular substrate surface, they may grow, and their growth will reach that level of infection. It is not always easy to recognize the infected wound, especially the early stages, because a person which is not trained in this field may take that particular outcome as a normal healing process. And in contrast, it may turn out to be one of a very serious pathological condition. Different types of wounds can show different signs when they're infected. That may complicate a little bit the diagnosis of infection, and it requires therefore training of specializing personnel to do the correct and timely diagnosis. All infected wounds, anyway, will show some of the following signs: fever, pus, abnormal smell, warmth and redness, delayed healing, edema. You may recognize some of those things, the characteristics of the inflammation process. Definitely fever, warmth and redness, edema, etc. The fight against infection in clinics, hospitals, the offices of our family doctor or infirmaries on campus, all of us have had an experience, I hope, that required the treatment of a wound, starts with cleaning that particular wound completely to avoid extraneous things. For example, if we have scraped our knee, to remove the dirt or anything else that might have stuck from the fall, such as leaves and other extraneous things. Importantly, the wound has to be cleaned using chemical compounds, and those chemical compounds include, of course, hydrogen peroxide and alcohol. Very dirty wounds attract the serious attention of nurses and doctors because they must be cleaned very carefully and very thoroughly. Otherwise, these wounds can become the site of infections and cause all kinds of medical complications. If the particular wound eventually will require some surgery, this particular procedure must take place in a sterile clinical surgical environment using sterilized materials and instruments. This last aspect will be addressed later on in this course. Treatment of infection requires pertinent laboratory procedures. These are procedures conducted in microbiology laboratories which specialize in these procedures, and they identified the type of the bacteria involved in infections. In addition, other procedures in those laboratories are used to determine if the infection is caused by pathogens which may respond to certain medication, let's say antibiotics, or they may be resistant to any treatment. These particular approaches help the doctors identify not only the type of the pathogen microorganism, but then what medication can be used in order to treat and therefore help a patient. This outcome is of very crucial importance in the case of chronic infections or infections which are not easy to treat. Despite several important advances in the treatment of medical-related infections, certain challenges in fighting infections still remain and need to be addressed. Such challenges are encountered with infected wounds which are chronic and do not heal. These wounds are associated with certain pathological conditions such as the ulcers which are developed in the feet and toes of people who have diabetes, or in the sores which developed in patients which are immobile as a result of paralysis and they are resting on one side of their body, usually on their back. The way the medical clinical environment fights infections is by using and delivering antibiotics. The delivery of antibiotics has been primarily through the following venues. For example, gastrointestinal delivery by taking a pill, a relatively easy way of delivery of medications and a method which is preferred by most people who must take some medication. Another delivery of antibiotics, and certain antibiotics are available only in liquid form, therefore they must be injected either intramuscularly or intravenously. A third delivery of antibiotics of importance to biomaterials biomedical engineers is to have these chemical compounds released from synthetic materials, either from the surface of the materials without degrading the material, or releasing them from a material which is degrading and resorbable. This particular last aspect has been of great importance in applications in tissue engineering. The use of antibiotics has proven to be a most effective way to fight infections. However, antibiotics are not a panacea. They don't solve all the problems related to infection. Some of those complications are related to bacteria, because the various infections are caused by different types of bacteria which have different sensitivities to the antibiotics which are available and are prescribed by the doctors to treat infections. From the point of the delivery, there are limitations regarding the type and the delivery of antibiotics to infected tissues, especially the ones around the implants where infection, for example, may reside. There are time-limiting effects regarding how far the antibiotic may diffuse or be released inside the body of the recipient. the efficacy of antibiotics may decrease or be neutralized. Why? Because they're delivered inside the body, which has a lot of other chemical bioactive compounds and chemical bioactive reactions which take place, and they might be the reason why the antibiotic drug is neutralized or it loses its potency. Last but not least, we always have to deal, or to keep in mind at least, the patient. Namely, they may have or develop antibiotic sensitivity, and that causes allergic reactions. One of the sensitivity which is well known is that of sensitivity to penicillin. When penicillin was discovered at the end of Second World War, it was greeted with such excitement because it turned out to be so strong and to treat many diseases, including one of the worst types of diseases which were around those days, specifically tuberculosis. These days, penicillin is not used almost at all. First of all, because that medication is not effective in treating infection, and in the case of developing antibiotic sensitivity, you know that many people have allergic reaction, and that can be from mild to very serious life-endangering situations to penicillin. Therefore, penicillin cannot be used in those patients. And as you know, many people wear bracelets which alert the healthcare personnel. For example, if that particular individual is involved in an accident and cannot speak or is unconscious, the paramedics and the nurses and the people in the hospitals can look at the bracelet, and then they realize or they know that this particular patient is sensitive to whatever drug is pertinent, including, for example, penicillin. I related to you some aspects of the history of penicillin, which was discovered and was heralded as the panacea drug which helped a lot of sick people. However, penicillin is not the antibiotic which is prescribed these days. There are many other antibiotics which have been developed, and the reason for that particular development is the fact that those pathogen microorganisms, which I mentioned many times, are pests and they need to survive. One way they can do that is not only to form the biofilm to protect themselves, but a very important way for them to survive is to become resistant to antibiotics, and they effectively achieve that by changing their strain. And the new strains become unresponsive to certain antibiotics. Therefore, the doctors need to have different antibiotics to treat patients who get sick because of the same old pathogens. The antibiotic-resistant strains of bacteria, this is how they are referred to, are a major clinical problem in the clinics and the hospitals which treat with infected wounds and very many other infection cases. For example, urinary tract infection caused by E. coli, you can see a micrograph of that particular growth. You can see in pseudocolor the E. coli cells, which are those elliptical pink color entities, and of course there are so many other things which perhaps there could be extracellular matrix of the bacteria or something else that accumulated in that particular environment. Bacteria and other pathogens which have formed a biofilm are protected because the biofilm structure is resistant to the antibiotics with which a patient is treated, and it is resistant to the host immune system, which means the first defense of our bodies with the help of the activated white blood cells. The biofilm which is formed by the bacteria is much more resistant to antibiotics and to the host system in that stage versus the planktonic bacterial. Remember, the planktonic bacteria are the early stages of those colony formations. Explanations for the observed resistance include the fact that the biofilm is not penetrated easily by antibiotics. The bacteria change their genes and therefore they change their strains. The bacteria which are present in the deep layer of the biofilm, remember those are multi-layered structure, have slow metabolic rates, and therefore even if the antibiotics reach them at that particular location inside the biofilm, even then these cells with a slow metabolic rate do not respond because the antibiotics developed and used are targeting dividing cells. The colonies inside the biofilm bring about the so-called persister cells. This is a small subpopulation of bacteria which have almost zero growth rate, and they are not affected by the medications, antibiotics for example, because they have slow cell growth or cell division. However, these persistent cells are there ready to be reactivated and become infections if and when they receive the appropriate stimulus for that particular purpose. Inside the biofilm, the bacteria develop the capability to pump out toxins, antibiotic drugs, etc., which may have penetrated the biofilm. This is an effect known as efflux pump effect. The extracellular matrix which the bacteria produce and deposit in their environment prevents the white blood cells from reaching them, and therefore prevents the function of the white blood cells, which is important, namely phagocytosis and subsequent killing of the bacteria present in the biofilms. Another critically important aspect regarding the availability of new antibiotics is shown on this slide. You see a schematic of the time course of the discovery of antibiotics, starting around 1928 when penicillin was discovered, and then the various other antibiotics, for example, streptomycin around 1943, and erythromycin in the 50s, and so on and so forth, till we reach approximately 1990. At that particular time, since then, I should say, for the last 30 years, there hasn't been much activity going on because the production of new antibiotics by pharmaceutical companies is either reduced or stopped completely. The The rationale used by the pharmaceutical companies is the following. They invest a lot of time and a lot of money in developing new medications which can be used to treat new and emerging diseases. Those diseases, the new ones and the ones that can use their newly discovered medications, can bring much better prices and more revenue to the pharmaceutical companies. Many pharmaceutical companies are not interested in developing antibiotics because the price of those medications is not a profit-making proposition for them. It is a sad situation, but it is a reality if one thinks of how the business world works and succeeds. The need of antibiotics is unquestionable. Therefore, some suggestions regarding of how to solve these particular current problems are shown here. Since we need new medicines to be produced by the pharmaceutical companies, some researchers and doctors and other people in the healthcare field have suggested that perhaps the government should subsidize these endeavors of the pharmaceutical companies and therefore convince them to develop and produce the new antibiotics and other related medications which are needed for the treatment of patients. From another perspective, either new or variations of the old treatment methodologies, people have tried to administer several antibiotics at the same time. You may have experienced this particular situation yourself. If, for example, you were sick and you went to your doctor, most of the times the doctors, they do not prescribe anymore one antibiotic, even if it is one of the newest antibiotics. Usually it's a combination of couple of antibiotics which are prescribed in order to treat you and make you feel well. Sometimes the methodologies which have been used is to use low antibiotic doses, hoping that that will promote in the recipient body the reaction to produce, or to enhance, I should say, not to produce, but to enhance the natural defense mechanism against the pathogens. The time course of medicine delivery or antibiotic delivery sometimes have been changed in order to change the pathogen environment and perhaps this way make them more susceptible to the antibiotic treatment. Another approach which has been investigated in many research laboratories at universities especially is to target a new delivery system, not intravenous or intramuscular delivery, but to target delivery of antibiotics in the intestinal system. This is where most of the benign microorganisms are present in the human body. And therefore, this is the side of medicine delivery which may be most effective. Keep in mind that in the gastrointestinal system, the first part of the stomach is the place where the various foods which humans eat are treated with chemical compounds to break them down to molecular level, literally, and then while this particular combination of food and chemical compounds is traveling through the intestinal system, this is where the absorption of the nutrients occurs. Therefore, the approach to target the intestinal system as the site of medicine, including antibiotic delivery, is something which various laboratories, research laboratories, especially at universities, are investigating. I must emphasize that this particular approach has its own limitations because the environment of the stomach and the intestines is the one which is the most acidic in the body. And you know that chemical compounds, specifically proteins, are very susceptible to environmental conditions such as pH, acidic pH especially, or temperature, or perhaps mechanical forces, which are part, of course, of the workings of the stomach. So this particular new development is worthy of investigation, but it has its own challenges and limitations. This presentation focused primarily on some aspects which are pertinent to infection and how infections are treated in patients and in the environment of the hospital and clinics. As it was mentioned earlier, infections are also associated with implants. This slide gives you an incomplete list of the various microorganisms, the various types of microorganisms which can form biofilms of biomedical devices. They are listed under the column entitled type of microorganisms, and then in the other column, which is entitled isolated from biofilm zone, there is a long list of prostheses which have been affected by this particular pathogen microorganism. And you can see artificial hip prosthesis repeated many times here, intrauterine devices, many types of microorganisms affect this particular implant, prosthetic heart valves at least 3 times, and a few other examples. I wanted with this particular slide to emphasize to you that the pathogen microorganisms are interactive with the biomedical devices, implant biomedical devices, and they form microorganisms. And these particular situations have been documented by results reported in the literature when these particular implants most probably had to be excised as a result of complications from infections which required, unfortunately, removal of the implant. An example of Staphylococcus growth on a polymer, polystyrene, is shown in this particular case. Frame A shows the growth of staphylococci on the polystyrene substrate in vitro, and frame B shows the biofilm which was isolated and examined after a particular shunt was removed from the recipient body. These are 2 scanning electron micrographs which give you an idea of the excessive growth of these microorganisms, both in vitro and in vivo. In frame B, in addition to those small circles, which of course stand for the Staphylococcus pathogen, you can see some other tissues, and of course these are, in this case, the respective paper explained that these were the strands of a fibrin clot. Biomedical engineers have been interested in what is happening when microorganisms attach and form biofilms on materials of implantable devices, and they have characterized some of these details. For example, some properties of the substrate come into play, specifically the texture and the roughness of the surface, whether the surface is hydrophobic, that means water does not interact very nicely with it, and definitely the presence of chemical compounds which are adsorbed on those substrates. Again, keep in mind that when a material is introduced in the body, within seconds it's going to be covered by adsorbed proteins which are present in body fluids and body tissues. From the perspective of the cells of the microorganisms, remember, it has to be an interaction between the cells and the substrate. The cell membrane hydrophobicity has proven to be a parameter. The presence of the flagella of the cells or absence of it, definitely without the flagella the cells become more adhesive. These cells, of course, now are the bacteria cells. Last but not least, the formation of the extracellular matrix by these microorganism pathogens, which is known as extracellular polymeric substance. If the implant is in an environment which involves fluid flow, the flow velocity has proven to be a parameter in how the microorganisms attach on implanted materials and devices, the pH, the temperature, presence of cations, and the presence of antimicrobial agents. What was learned as a result of extensive research in the field is very important, and we must keep in mind these particular facts regarding infection associated with implant materials and devices. Growth of bacteria in implants is tenacious and difficult to deal with using, for example, antibiotics. Chronic infections lead to the requirement of removal of these implants via surgery. If it is at all possible, reimplantation, namely after you, let's say, particular implants, a hip prosthesis or any prosthesis is removed, reimplantation, which means introducing another hip prosthesis or another knee implant, if it is possible, and the case of total hip prosthesis is not, this reimplantation must be delayed until the infection is completely and successfully suppressed and the surrounding tissues have healed. This schematic illustration repeats some of the aspects which we saw in another earlier slide. Just to summarize, we have the approach of the planktonic bacteria making a reversible interaction which becomes a permanent adhesion, accumulation of the bacteria, their growth and maturation into a colony which is protected by the biofilm, and eventually when that particular biofilm matures, it becomes too big for certain reason, the bacteria is released and they can move downstream and start a colony in another part of the body. In addition, this particular illustration brings to our attention the two stages of the infection when it is early and acute, or it becomes chronic and very different, I should say, very difficult to treat with antibiotics. As shown on the very lower part of this particular illustration, the opportunity that antibiotics have to be very effective is at the early stages of the interaction of bacteria with substrates, namely during the adhesion, early and then irreversible, and accumulation. Once that particular colony grows and definitely reaches the mature biofilm situation, it becomes very difficult to treat with antibiotics, and definitely it is not possible to be targeted by the activated cells of the immune system, specifically the activated leukocytes. In some respect, this particular schematic now gives us some ideas of how biomedical biomaterials engineers can target and attack the process of biofilm formation on synthetic materials, and perhaps in that fashion bring about a defeat of the biofilm formation inside the body of recipient patients. From the biomaterials perspective, therefore, the approaches which appear to be very promising in defeating bacterial infection and growth of biofilms is to put together biomaterials which resist the adhesion of bacteria, number one, and number two, to resist the growth of the biofilm and the formation of the mature biofilm. Some other current research areas which have been explored to overcome bacterial infections of implanted devices are related to diagnosis of infection, and biosensors have been developed and used for such early detection. Advanced imaging techniques have been developed and used. The use of nanoparticles, again, have been used for detecting and localizing the site of infections. The other approaches address treatment. For example, photodynamic therapies have been used. In such a case, we have production of oxygen radicals from photosynthesizers upon reaction with light and oxygen. Bioacoustic techniques such ultrasonication, namely that particular way is to shake the particular biofilm, hoping to break it up and disrupt its adhesion on the substrate surface. Electric and magnetic fields have been explored. And last but not least, techniques to break down, to dissolve the extracellular polymeric substances, which of course is the name for the extracellular matrix of bacteria colonies under the biofilm. Prevention approaches have also been explored. For example, biomaterial surfaces have been coated with antibacterial compounds, antibiotics, for example. This way, it is hoped that the antibiotic will kill the bacteria, will not allow it to adhere. If it comes in contact, it will kill it because of its antibacterial function. Another way to prevent this infection is to disrupt, as I mentioned in a few other earlier times, to disrupt the biofilm formation. And last but not least, to modify the chemistry of the material surfaces in such a way to avoid or to prevent the interaction with the pathogenic microorganisms. All and some of these aspects and many more are being under investigation in various research laboratories as we speak. Future direction and challenges, as well as opportunities, of course. Every time there is a challenge, there is always an opportunity regarding biomaterials, is to design, formulate, and produce infection-resistant materials. To design, formulate, and produce materials which both promote surrounding cell tissue interactions pertinent to new tissue formation and resist infections, therefore resist the interactions with the pathogen microorganism. And of course, there's plenty of room for new creative ideas, which I hope your generation of biomedical, biomaterial scientists and engineers will introduce, explore, and successfully bring to completion in order to help the patients in the clinics and the hospitals who are suffering from various infectious syndromes and definitely infections around implant materials and devices. This is the end of lecture 21 with the title Infection.